Hey everyone, it's lovely. Oh, I've got a clicker. Okay, great. It's got a fancy title. So, the time bomb of health risk. So I think that there is a real opportunity that we all have here, and everyone in this room has some influence over, which is, can we help the people that we work with live happier, healthier, longer lives? And that's a question that we're asking ourselves. If you go into that hall, there's a gazillion people out there trying to tell you how they can help you do it. I'm going to try in this presentation not to tell you how I do it, or I'm not trying to sell you anything. I'm hopefully going to give you some insight as to what we've done and what I've learned. So these are the easy stats, right? Ultimately, lifestyle choices determine illness in a very, very large range of cases. 80% is the number that we have. We know that insurance, directly correlated to the health of the nation, is increasing in its expensive, it's more expensive, cost of living and loads of other reasons, but ultimately also people don't look after themselves particularly well. We also know that most companies who try and do something with health don't manage to get the engagement that they should be. So, some people say, well, what's my responsibility as an employer? We all agree that these are communities that we love and we care about. Ultimately, we want them to engage with the magic that we give them to try and help them make those better life choices such that they live their best lives. But it's not happening. So it was just quite fun. Health insurance is rated as, 1 in 3 will rate health insurance as the #1 employee benefit, 1 in 5 people living in the UK living with major diseases by 2040, and 65% of businesses with over 1,000 employees are fairly or very concerned that their waiting times may increase. So that's with reference to the lovely NHS, which is currently under quite a lot of strain. So I think we all see this enormous challenge ahead of us around what does it mean to have a healthy organization with a healthy workforce, and how do we support them to maintain that? Now, unfortunately, my colleagues didn't read the Economist article that I did, and for the discerning viewers, you may have read that yourself, around blue zones and the questions around the data of blue zones. But what I can tell you is that I think it's pretty clear these are the factors in the above circle of what is it that makes us live our best life. Sleeping properly, eating, regular movement, plant-based diets is a path, caring for your loved ones and being part of a community. These are all things that are factors in what it means to live a worthy, a good, a happy life. And the way that I like to think about how insurance, the intersection of insurance and this idea of living your best life is no one is more incentivized than your insurer to help you live this life, because ultimately they pay if you don't, which is, every day when I get a claim, I'm like, okay, that's an inspiration, an opportunity to help someone not have to make that claim in the first place. So, what can we, you, everyone, do differently to achieve a different outcome here? Not a scenario where there's 2% engagement with health benefits, not a scenario where we are having this lifestyle disease crisis, not where our insurance premiums are increasing as a result. And I think a lot of people have already realized that prevention is ultimately the key here. Can we help people not have the issue to begin with? Can we invest further upstream? And in America, where I work a lot at the moment, this is even bigger because they have their health insurance system, which is a very expensive thing. And what you find is that they're obsessed with how do we mitigate the need of needing to go to the doctor? What can we do? And they have like diabetics on monitors to make sure that they are using insulin correctly to help mitigate the costs on their insurance premiums because they're so expensive. I don't necessarily want to live in that dystopian future. However, in the UK, I think we can all agree that us helping people mitigate the needs to go and sit in the waiting room at their NHS hospital or go into the private GP where they take the morning off work because they are unhappy, uncomfortable, unhealthy is something we would love to all avoid. So this is what prevention means. Don't know if that wasn't clear. So there was this guy called BJ Fogg, and one of the challenges that we identified as a business is, how do I get people to do something that they don't want to do? And this is like fitness, right? So my wife will say, let's go for a run in the morning. As you can see, I haven't, or ever. And I don't know if other people in this room have experienced this fact that we don't really want to go out and become wildly healthy sometimes. There are people that do, but there are people that don't. And how do we motivate someone to do that? So this BJ Fogg model was the idea that somebody with the ability to, I have legs that can move forward and I cannot pass out on way. I have the motivation, so I actually think this is something of value for me and I I want to do this, not I need to do this, but I want to do it. And a trigger being my wife hitting me with the baby monitor in the morning to get out of bed and do a bit of exercise before I go and get dressed and go to work. So this is, for example, how we achieve behavior. That's the argument, that if we have an easy way to do something, we have hunger to do it, and then we have something that inspires us, then we will achieve the target behavior. And there are lots of mechanics that do this, and I'll give you something that maybe we've all experienced in this room. The news. So I remember on the train when Boris Johnson got kicked out, and I remember I was sitting on the train and somebody goes, "Have you heard he's been kicked out?" Trigger. Ability. I have the BBC app on my phone, so I'm going to open the BBC app. Motivation. I am really nosy, and I want to know what just happened. This is how software uses these kinds of mechanics in our everyday life. You just have to think of it like that. So what is the problem? How can we apply this in our collective context of, I have a company, I work for a company, and I want that company to be focused on helping people live healthier and using smart technology feelings to make that happen. Now, a lot of companies struggle to be able to identify how to do this. Most projects fail. Most new initiatives don't work. You look back on that money that one spent, on that commitment that the sales guy made you, that this would be a new world you'd all be living in, and then that reality has not presented. This is a very common issue with wellbeing programs, partly because the articulation of a wellbeing program can be fluffy and not necessarily clear enough in its business productivity improvement from having a healthier, happier workforce through job satisfaction, and then what that means for the bottom line of a company. So being able to quantify that, we know will help transform what has historically been looked at unsuccessful wellbeing projects into wildly successful wellbeing projects. Better clarity of what metrics are moving and what matters. So how do we do this differently? So this isn't what I do, this is what I think you all should do. And when you're doing your next wellbeing program, please, I think you should heed this advice, but you can also ignore it. So you do you. Do you educate? Do I go, you know what, I'm going to release a PDF, I'm going to release this new TikTok video to all of my staff, and I'm going to educate them on how to be healthier, happier, whole. I'm going to do that. So my opinion is that education isn't the way forward, because education is like, I'll show you what I mean, but like, if I haven't, in my 33 years of existence, been interested in something, you telling me that there's a PDF available is not going to suddenly make me care, right? We've all received those newsletters. You care probably less post-reading the title than you did before. So I don't think this idea that we are the teachers is the way to think about ourselves when we're trying to design these solutions. Nor do I think that tracking is the way forward. So now I want you to think of that guy or girl who cycles into work every day. I'm really impressed with them. I wish I could do it. I can't do it. I think, wow, you're amazing. Those people are showing you Strava and are showing how obsessive they are at tracking their performance. Well, tracking one's performance is already after you've made the decision this is something that's important to you. So changing that behavior, tracking doesn't do anything. Showing the metrics of my engagement does nothing to determine whether I engage further, right? It's just it's a mirror. So tracking isn't how you change the behavior of your staff. The way you change the behavior, and ultimately the things that lead to good participation, is having people do the thing because they want to. So the fact that I chose the BBC app in my head in my previous example, that's participation. You know, the byproduct of that participation is I learned all about how Boris did a series of things that were pretty reprehensible, according to that BBC article. So it's a really good example of the situations that we face every day. How do we teach people to do this good stuff? Well, we need them to participate because they want to. And this is a Pokemon Go thing because that was a really good example of a health app that no one really thought of as a health app. And there were boys and girls all over London chasing down these virtual creatures, but actually improving their heart rates, increasing their daily step counts, and having a tangible effect on their longevity, which we now know. So we looked at like these models, and maybe this is when you think about designing your kind of employee well-being program, the challenge you have is how do you create something that is for everyone and not just that top few super engaged people? You know, if I look at a lot of the programs that companies will offer, they always focus on this top of a pyramid of people who get all the value in these programs. The trick is to stop asking yourself to solve everything at once, but only to solve one small thing that impacts everyone, and then everyone's on the journey together, and everyone's getting some of the benefit of your love and care. And I think that's like a really different way of thinking about, I have a customer right now who is a very, very large supermarket, and I'm having a bit of a disagreement with them. They want to cut something that's applicable to 60,000 people, where I've got, I think, 15,000 people using it every day. And they don't want to cut the service, but they want to cut an element of the service, and because they want to add cancer screenings. Now, don't get me wrong. Like, I'm all for cancer screenings, but where does the relationship start and where does it end for a company? And it's really difficult to know what to do in that situation, because she wants to save the lives of maybe 4 people who may at some point in their relationship with that company, like, discover that they do this cancer screening, do the cancer screening, and then find something that's a problem. But her daily value that she's adding to these people and inspiring them through participation to be healthier is non-existent, because that's where she decided in this moment to put her money. So it's just interesting, this idea of do we benefit the few in our organization, or we try and benefit the broadest, most, everyone. This is our app. I'm sure you've spoken to us, Stan, so I don't really want to talk too much about YuLife and what we do. I think you can go online at yulife.com and check it out. Well-being every day for everyone is the theme. And the thing that I found when we started building out these engagements and applying game design to kind of daily living and daily health, we found that people ultimately attended work happier, were more present, less absenteeism, happier staff, all the stuff that you know should happen from an engaged, happy audience. And yeah, so these are the kind of metrics that we got. Increased step sounds a bit unexciting, but the reality is physical movement is the #1 thing when it comes to longevity, outside of the alcohol and the pre-existing like genetic conditions. That's the end.